Last fall, we expanded our partnerships at Virginia Tech by working with the new Smart Healthcare Hub, which is one of Virginia Tech's new destination areas, to launch the inaugural Future of Work in Health Faculty Fellows program.
The Center for Future Work and Smart Healthcare Hub Faculty Fellows program is a joint effort between the Center for Future Work and our destination area, Smart Healthcare Hub, to support faculty who have promising ideas, but maybe need a little bit of resource to kind of build the infrastructure to launch their ideas.
This initiative was designed to advance interdisciplinary research at the intersection of work, technology, and healthcare. We challenged Virginia Tech faculty to bring new interdisciplinary perspectives to the Smart Healthcare Hub that could further advance what was already happening while paying attention to transformations in the place and practice of work in the healthcare sector.
Technology is incredibly important within healthcare. However, we do a ton of work, a ton of research on developing great technology, but we don't do an excellent job of making sure those interventions can translate well into clinical care. That's where the Smart Healthcare Hub is meant to live, thinking about how do we take excellent ideas, great clinical interventions, and actually translate them into clinical practice so that patients as well as clinicians can benefit.
We are really excited to share the research being advanced by our 3 inaugural faculty fellows. Dr. Melissa Fessel is creating an AI-powered system to help doctors predict and respond to pediatric emergencies in real time by giving clear and personalized treatment guidance before a child's condition worsens.
Children don't tend to get sick as much as adults. And when they do get sick, they get sick very, very fast. And now you have a small child who's very innocent and very, very sick, and you only see that every once in a while. What you have to do is decide how sick they are, what is wrong with them, and how am I going to fix it fast enough to stabilize them to get them somewhere that can take care of children. In that situation, your brain gets hijacked. You don't necessarily take the time to pause and pull out a cognitive aid or pull up a computer and look up what the guidelines are for this patient in this situation and then make it happen.
Dr. Rodrigo Salo is developing a contact-free sensor system that uses vibrations and AI to track how people walk at home.
My project for the Future of Health Fellowship is focusing on this idea of passive sensing, and specifically for human gait. Human gait is important for health because it acts almost like a vital sign. If you have physiological problems, all that cascades into the way you walk. And so monitoring the way that people walk is an important indicator of overall health. I'm interested particularly in how we can use floor vibrations as a way to track health, particularly in a home setting, to help doctors make decisions about the overall health of the patient.
Dr. Daeyoung Kim is developing a new interactive scenario-based training tool to help engineers design safe and effective healthcare technologies.
So at the end of the project, the artifact that I will create is actually an interactive training tool that engineers who are interested in entering healthcare industry or are currently working in healthcare industry but want to develop their systems thinking skill actually utilize to develop their skills. Because of the industry's significant impact on human health, I thought understanding engineers' systems thinking skill or decision-making behavior within their organization is very important to better prepare engineering students to be able to work effectively in such an environment after graduation.
My anticipation is that as we mature, Center for Future Work will continue to invest in healthcare, but will also apply their expertise across lots of different domains. I would love to continue to see collaboration between the folks who are providing insight on what the future of work could look like and healthcare specifically, which is a domain that is very slow to change, really working more closely together. And I would love to see Virginia Tech as a leading innovator in what the future of healthcare could look like.
The Future of Work in Health Faculty Fellows program, you can think of it really as a launch pad to enable faculty to really scale up ideas that they're thinking about.
In terms of next year, kind of the immediate future of our Faculty Fellows program, I am very hopeful that this small investment really makes a difference for our inaugural class of fellows.